In this week's show, Dr. Kevin visits the Melbourne Lost Dogs Home, which celebrates its 100th year anniversary. We join our puppies for week 5 at puppy class with trainer Chris. But first, Dr. Kevin talks to us all about how important it is to regularly take our pets to our vet for a checkup.
Tara's come in for her annual vaccination. This is more than just an inoculation. This gives me, her vet, an excellent opportunity to give her a thorough physical exam. In addition, I'll obviously be speaking to her owner about any health or behavioural issues that she has. It's very important when you book that checkup with your vet to bring a list of questions so that you make sure you don't miss any of those problems that you may have had questions about over the preceding year. What we look for initially is the quality of her coat. We can tell from Tara's coat it's in excellent condition. She's got a beautiful shiny coat. And I can tell from the quality of her coat she's obviously fed a good quality diet. Dogs that are fed poorer quality food, it comes through on their coat, and we know that a lot of dogs with skin problems, these can be traced back to poor quality foods. The one thing we will immediately look at are Tara's teeth. Part of any exam requires a full dental exam, examination of any tartar or gingivitis. We also then look through her ears. Signs for infection, a redness, swelling, or sometimes, yep, I will do this, a smell. No smell there. Good girl, Tara. Perfect. We have a feel for her lymph nodes that are situated under her chin here, through the front of her legs, and we'll give her a full thorough physical exam in regards to any skin, lumps or bumps that she may have present. Good girl. We'll have a feel through her ventrum or her belly region. Female dogs, it's very, very important that we have a feel through her mammary chain. Female dogs that have been desexed late in life will develop mammary cancer, and it's actually very prevalent. So what I'm looking for here are any lumps or bumps that might be present through her mammary chain. The other thing I'm actually feeling for is I'm giving her what we call an abdominal palpation. Every vet has been surprised with unexpected results while performing abdominal palpation. What we feel for are the presence of any bladder stones, also any lumps or bumps that might be present in their liver or spleen. The good news for Tara and Tara's owner is that she feels perfect. Good girl. What we'll do now is have a listen to her heart, listen for any arrhythmias, any presence of any murmurs. Perfect. The presence of murmurs in dogs will indicate that there may be a valve disease present. Valve disease are actually really common, particularly in small dogs as they get older. Now, one thing that you may notice your vet do is lift up your dog's tail. Don't be all alarmed. That's how we take dog and cat's temperatures. Elevated temperatures can sometimes be an indicator of underlying illness, and it doesn't hurt them at all taking their temperature this way. A little uncomfortable, but not at all painful. Good girl. Her temperature's completely normal, that's excellent. Good girl. Okay, well that was part and parcel of Tara's full physical exam. She checks out beautifully. She's a beautiful weight, body condition's excellent. She's got a nice pelvis, nice set of hips on her. Coat's beautiful, no evidence of any fleas. Teeth could do with some marginal improvement. We'll get the owner getting her on some more bones, getting her chewing a little bit more regularly. But what we'll do now is we'll just organise her vaccination. Good girl. Good girl, Tara.
Let's practice.
Henry's come in for his annual checkup today. He's a beautiful ginger boy, about the age of 3. First thing we'll do when we have a cat that comes in for the consultation or their annual checkup is pop them on the scales. It's a really important sign of health that cats are sitting at a good weight. Make sure they're not losing weight, that's really important. We can work through cats that are gaining weight by putting them on diets and manipulating their diet a little bit. Henry's about 5.7 kilos. His ideal weight's probably closer to 5.5, but at this stage I'm not too fussed about that. Let's have a look at his teeth. What we're looking for are any signs of dental disease at all, any evidence of any gingivitis or tartar accumulation. That's looking pretty good. I'm really happy with how that's looking, and what we know is that cats that are fed raw chicken necks, raw chicken wings like Henry is, on speaking to his owners, will very rarely end up with dental disease. We have a feel for his glands and we have a look through his coat. He's got a beautiful coat, no evidence of any flea dirt. Beautiful clean, no scaling, no dryness. Very, very happy with the quality there. We're just going to lift up his tail. Nice and clean. Beautiful. Good boy, Henry. I think you're quite enjoying this, aren't you? Hey? Now, as part of any exam, particularly of cats, we will give them a nice, thorough abdominal palpation. What your vet is feeling for is any stones present inside their bladder. But in particular, we're feeling for their kidneys. Cats have kidneys that should be of a particular size and they're quite easy to feel. Changes in their size or firmness, or if there's any pain present in that region, can sometimes be cause for concern. We'll also have a feel for their gland or their lymph node present within their belly, and he palpates beautifully. Good man. Now, what I do know is that Henry's due for an intestinal worming tablet, so cats can sometimes be a bit challenging to give that. So I'll show you my little trick. What I tend to do is we just pop a thumb and a finger on either side of Henry's jaw, and he's going to pop his little paw down, but his jaw will drop down. Good boy, Henry. Open wide. And we'll pop that down his throat. There we go. Good boy, Henry. He's got quite sharp nails, and the owner has asked that I give them a trim. Little cat nail trimmers like this make the job really easy, and it's just a matter of giving them a bit of a trim like that. Good boy. They're quite sharp. Cats will trim these down naturally if they do have things like scratching posts. But learning how to trim your cat's nails, particularly when they're kittens, can certainly save your furniture, save your Persian rugs too. And as you can see, although some cats might react to it, it's not at all a painful sort of exercise. Henry's tolerating it really well. Good boy. Now Henry is due for his vaccinations, so whilst he's here, we'll give them to him. But before we do that, we'll just have a quick listen to his ticker. That sounds excellent. Good boy, Henry. Let's give you your vaccinations. Henry's due for 2 vaccinations today. His cat flu vaccine, as well as his feline AIDS vaccine. Henry spends a little bit of his time outside and does interact with other cats outside. And it's important that we have that protection of the feline AIDS or FIV, feline immunodeficiency virus vaccine on board. So he's going to get 2 needles. I'm sure he'll behave when he gives them. Good boy. There we go. That's 1. Didn't even notice that, did you, mate? And this is his second one. Good boy. Hey, Henry. I certainly think that I can give you the clean bill of health. I'll give your mum a call, Henry. The only thing we maybe need to talk about is your waistline. We don't want him at risk of developing diabetes, do we? Good boy.
That's practice. That's practice.
Each week, we follow a group of 5 puppies through puppy school and into adulthood. Our resident trainer, Chris Loverseed from Positive Canine Training, will take the puppies, and most of all their owners, through a series of exercises and training situations. The exercises they do will help socialise the dog and allow the handlers to have a basic level of command and control of their new pets. In our class, we have Kylie and her bull Arab Buddy, Philia and her cavoodle Elfie, brother and sister Kim and Sue Lee with their Shih Tzu poodle cross Emmy, Steph and her chocolate Labrador Strider, and Sally with her old English sheepdog Pirate.
So how's everybody been doing during the week? Good? That's good to hear. So I'm be asked some of the same questions that I've asked last week as well. So who thinks they have a reliable sit? And so we've got yes. You don't sound too convincing. Emmy, yep. Getting there. As long as you're making progress, that's the main part. When I'm teaching a recall, I always like to have a dog on a long line. So that way, if a dog doesn't come, so I can do one of 2 things. If they have a very good understanding of what come means, I might give them a quick pop on the lead, keep them popping to get their attention until they come. Or if they don't come, if their understanding is not that good, I'll use a long lead to drag them back in, and really, when they get pretty close to me, start really motivating them to come. So they understand that every time they hear the word come, regardless of whether they want to come in or not, they're going to come. Obviously, we're going to do our best to motivate them, but sometimes puppies get airhead, they're all way over there. No, I don't want to listen to you. I'd rather sniff the ground or play with another dog. So they have to understand in those situations, you're still coming regardless. Okay, so to start off with, I just want to do a little bit of social walking, loose lead walking. How's everybody been going with that? Good? No one sounds too convinced. Okay, I've got conviction from the middle two, don't know about the rest on the outside. So all we'll do is we'll get started. So everybody remember to be consistent with what side you walk your puppy on. So if they're walking on your left-hand side, make sure you keep them there. So if they're on your left, hold the lead on your right. Have some treats on your left-hand side as well to pep them up. Also start to introduce quite a few sits as well. Because if you're walking along and you stop, sit, the dog has to pay quite a bit more attention to you. Now one thing I want everybody to start introducing as well is a little bit more of a formal exercise and almost a non-verbal command. So I'll do it with all my dogs as well. So my dogs ask them to sit. Whenever I step off with my left, I step off on my left leg. So my dog understands that when I'm on my left leg, it's time to walk. If I step off on my right leg, you need to sit. So do you mind if I take Strider for a second just so I can show what I'm talking about? Strider, come on pup. Good puppy. So Strider, sit. Good, so I step off on my left leg, start walking. It's pretty excited, which is good. Give me a bit of a roar there. Come on, puppy. Sit. At least I'm not coming around as much. Yeah. So step off my right leg, sit. Good. Give a little bit of a reward there. Sit. Step off on my left leg and go to walk. Sit. Sit. On my right leg. Okay, free. That makes sense to everybody. So everyone wants to get started on that. Spread out a little bit. Good. Okay, now while everybody's walking around, I'm going to do some noise desensitization as well. So I've got a little stock whip with me. I'm going to start off the stock whip at a low level, a little bit of noise, and slowly intensify it. So if your puppy reacts, try your best to stay calm, just ask them to sit again. But just keep on walking around. So I get everybody to stop and sit with your puppies. Socialisation is about more than just having your dog meet other dogs at the dog park. To prevent issues later in life, puppies need to be exposed to a variety of situations, sounds, sights and smells. It's really important that puppies are desensitised to loud noises, people in masks, helmets or unusual costumes, and also different environments such as streets, houses, parks and so on. Socialisation should continue intensively throughout the first 6 months of a puppy's life so that we can help prevent them developing a fear later on. Okay, now what I want to start working on today is what we call the 12 o'clock sit. So pretty much with a 12 o'clock sit, we have our dog on our left-hand side, we ask him to sit, we move all the way to 12 o'clock like that, right in front of him. Because what we're going to start working on later today is also having our puppies dropping in front of us as well. So we want to start phasing out our hands a little bit more of a drop and getting him to drop quite a bit quicker. So do you mind if I take, who am I going to take for this one? My buddy. Buddy, it's not playtime, come on. Come on little puppy, come on buddy. Good boy, good. Buddy. So this one's really good exercise, so I like to practice it. So it's one that you can do it for traffic lights and all those sort of things. So stop, walk in front of your dog, and also when you're out walking as well. And also it's a really good one for opening up front doors and all those sort of things. So you open up a door, ask your dog to sit, walk in front of him at the door and make him wait there, which is really good. So learn a little bit of impulse control. So what we're going to do, buddy, come on. Sit. Going to walk right in front of him. So this way it's good as well, because if a puppy moves, we can guide him straight back into position. Going to give him a few, sit, sit. Give him a few rewards while he's there. Good. And I'm going to come back over here, sit. It's really important, if they do move from a sit, guide them straight back into position. I'm going to step off on my left leg again. Sit. Good boy. Come back here. Free, sit, step around, good boy, good. Okay, free, and move away. Does everybody get that exercise? Okay, so if everyone wants to just have a little bit of room in between yourselves to practice, that's it. So if you can, try to go to the lead length of your puppy. It's okay. Good. Turn straight in front. Good. You've been practicing this one with him?
Yeah.
Yeah. Have you found it getting better with a drop as well?
Kind of, yeah.
Kind of? Yeah, it's good. Little bits of progress at a time, always good. Huh. One question, why are you saying stay? Does he have any idea what stay means? Now, so with us, because it's reinsurance in your head, it's a human emotion. So with us, I remember sit means sit until free. And so if you keep on enforcing sit, so you move from a sit, you get put back into a sit until released. It makes your life a lot easier. I think because stay's not something they really understand. They should understand that sit means sit and drop means drop. So that's it. Yeah. Good. Good. Good boy. Good boy. That's nice, Strider. Really good. Free. That was really nice. Good. You're doing too good, Emmy. How's she doing with a drop?
She's doing okay with the drop. She,
Starting to phase out food a little bit. Your hand a little bit low.
yeah.
Good. A lot nicer than last week, though.
Yeah.
Yeah. Good. Sitting on the left-hand side as well. I like that.
That's practice. That's practice.
Thanks, Kate, for inviting us here today.
Thank you for coming. It's a pleasure to have you.
Could you tell me a little bit about the history and the heritage of the Lost Dogs Home here in Melbourne?
Yeah, sure. The Lost Dogs Home's been on this side in 2 Gracie Street, North Melbourne for 100 years. We just celebrated our centenary last February,
Wow.
which is a fantastic milestone. We're
Absolutely.
really proud of that. So I guess we're quite a well-known organisation in Melbourne,
Yeah.
a bit of an icon, and yeah, we've been caring for dogs and cats for 100 years. And not only just caring for those that come in daily, but we're also, trying to look forward into the future as well and provide proactive
Yeah.
services as well.
Excellent.
So this is our adoption area, Dr. Kevin.
Yep.
And I want to introduce you to Shiloh. She's one of our dogs up for adoption at the moment.
She's beautiful.
She's gorgeous, isn't she? Look, such a sweet dog.
Yeah,
And I
absolutely.
guess Shiloh's one of the dogs that we've actually provided extra training for.
Yep.
Quite often we get
Hi, Shiloh.
stray dogs in here. They're not claimed by their owners, and they've probably been poorly socialised. Spent a lot of time
Yeah.
in a backyard. And we know that we need to give them some extra training to make them suitable
Yes.
for adoption.
Yes.
So Shiloh's been through our behaviour modification program.
Yes.
She was really scared. And
Was she really?
Yeah, it's hard
And
to
look at her
believe
now.
it. she's
Incredibly
scratched me.
affectionate.
Yeah,
I'm sure she'll be snapped up, Kate.
yeah. I know she's not only pretty, but she's got a lovely nature.
Yeah, absolutely.
she's a gorgeous dog.
Are there any other similar stories
Yeah,
through here?
sure. We have quite a few dogs that go through behaviour modification, but another thing that we do is we provide veterinary care
Yes.
for dogs and cats. So this dog here, Cindy, she's a really good example of
Hi, Cindy.
the extra services that we provide lost and unwanted dogs to prepare them for adoption.
Yes.
Cindy came in, she'd been hit by a car, we think, that's our best guess, and she's dislocated her rear hind leg.
Yes.
And we had to perform surgery to make her comfortable
Yep.
and get her ready for adoption. And now she's ready for a new home.
Now she's ready for a new home.
Yeah.
She's going to be in this adoption area until she finds that home.
That's right. So
Yep.
hopefully someone will see her beauty and
Yeah.
and fall in love with her and take her home.
Well, that's fantastic
Yeah.
that the Lost Dogs Home put in those resources and the time
That's
to look
right.
after dogs like Cindy.
Well, that's what I guess our donors give to us for.
Yes.
They give us donations so that we can perform these surgeries
Yeah.
and provide behaviour rehabilitation as well to
Yeah.
give these dogs a second chance. You
Well,
just look.
Kate, we've seen these beautiful dogs. Can we go check out the cats?
Absolutely, yeah. I'd love
Excellent.
to show you the cats. So Dr. Kevin, this is our cat adoption area. We've got,
Wow.
yeah, it's really, really lovely.
Yeah, it is.
We have lovely Blair here, who's
She's
very
gorgeous,
smoochy.
isn't she?
Yeah, she's gorgeous.
So these are cats that have come in, they've been assessed, and then now they're up
Ready
for
for
adoption,
adoption.
ready to find new homes.
Absolutely. They're all desexed, vaccinated, wormed,
Yep.
microchipped, and yeah, looking for a new home, as you say. Some of them take a lot longer. We'd love to see more people adopt adult cats.
Yep.
We find that the kittens go really, really quickly.
Yes.
But cats like Chip, Chip has been here since January this year, constantly overlooked. So we'd love
Oh.
people to sort of consider an older cat because they
Yeah,
just.
and there's so many upsides to get an older cat in terms of that personality. You know exactly what you're getting.
Absolutely,
the health
yeah.
as well. And,
Yeah, yeah.
And
So
you really are saving.
You're really saving a life, aren't
yeah,
you?
that's
Yeah,
right,
because
you know.
we have so many, and particularly at the moment, we're currently quite full with adult
Yeah.
cats. So we'd love to see more people come in and adopt.
Yeah, absolutely.
And then down the end here, we actually have gorgeous Nala. Nala's another long-term resident
Yeah,
here.
we open up.
Yeah, we can open
Yeah.
up Nala's cage.
Excellent. Hi, Nala.
Hello, Nala.
Oh wow, she's beautiful,
yeah.
isn't
So yeah, you can use these.
she? Have a hold.
Absolutely. She's all
good
yours.
girl. Hey, good girl. She's beautiful.
I know. They're really gorgeous cats, and you just sort of,
And-
I don't see how people can overlook them.
Yeah,
you know,
that's right.
for a kitten. I mean, kittens are cute and they play, but
Yep.
Nala, I'm sure, will settle down on the couch,
Yep.
you know, immediately the
Absolutely.
first night, snuggle in. And
So, Kate, all these cats that you've got up for adoption are listed on the website.
Yes.
So, if people are interested, what's the process?
So they can just go to our website and have a
Yep.
look. Everything's there, and once they're adopted, they come off the website straight away.
Yep.
If they like a cat, they can put it on hold. They can give us a call at the
Yes.
shelter, and we can put it on hold for them to come in and have a look.
Yep.
Or they can just come in. I mean, there's so many to choose from, and
Yep.
you know they're bound to find something that
Yeah,
suits. Yeah,
absolutely.
Yeah.
Well, let's hope you find a home very soon.
Yeah.
eh? Good girl.
Great.
Let's practice.
Nicole, you work with the dogs here at the Lost Dogs Home in regards to the behaviour modification and training. Could you tell me a little bit more about your role here?
Sure. Well, we run a program, a behaviour mod program for dogs that are not quite right to go to adoptions.
Yes.
So they need a bit of extra time. So,
Yep.
for instance, Portia here.
Yep, she's beautiful.
She's absolutely gorgeous now, but when she came in, she was very under-socialised.
Yes.
She wasn't used to being handled. So this class and this course just
Yep.
helps her to become more worldly,
Yep.
really, before she goes out
Yep.
up for adoption.
And I can understand, obviously, every dog is different, but in terms of the standard behaviour modification course length, how long would a dog like Portia
can be,
stay
oh.
in the course for?
Portia, probably a week or two.
Okay,
Yeah,
right.
so it can be as little as a day.
Yep.
And as long as months.
Yep.
Depending on what the problem is.
Yeah, well, and it's you working with the dogs as well as some volunteers.
As well as volunteers.
Yeah.
Amazing volunteers like Antonio
Yep.
who take time out of their day to come up and help us.
Yeah. Are there some other dogs you could show me
Yes,
that you're
yeah.
working with at the moment?
Over here is Ace.
Yep.
When Ace arrived,
Ace.
he was simply untrained, really
Yep.
unruly. So
Yep.
the type of dog that would greet you by boofing his whole head into your face.
Yep. Wow.
So Angela,
Yep.
lovely volunteer,
Hi, Angela. Well, thanks. How are you?
is teaching Ace some manners.
Yep.
So we're rewarding him for not jumping on
Yes,
people.
yep.
We're turning our backs on him when he does jump on
Yes,
us to
yep.
withdraw our attention.
Yep.
And he's turning into a nice gentleman.
Yeah, absolutely. So,
Yeah.
you know, not overly difficult, but just, you know,
Yes.
consistent, time-consuming, and the reward at the end of it is him being a well-socialised,
Yes.
well-trained dog
Yeah.
that is suitable for
Adoption.
adoption.
Yep.
Let's practice.
All right, so obviously with Jack and his previous medical history, we don't know what vaccinations he's had. That's why we've done the first one. We get you guys to follow through with the second one. We do give you the limited health cover, so for the next 2 weeks, anything relating back to anything he might have picked up while he was in here, we will do the consultations free of charge. We'd only charge you for medicines or procedures if he needs it. So feel free to give us a call if you've got any questions or anything. So we are going to need to do plenty of exercise and do on some kind of Weight Watchers food. So he's going to have to have a strict diet and be on proper meals. I'd be thinking, because we are about 3.5 years an adult, so up to you guys if you want to do 1 or 2, probably better to do the 2, just because you can kind of monitor what he's eating. Plenty of walks as well, so you can do 2 or 3 walks in the day so that we are getting that exercise, burning the excess fat. So the last one is the obedience training, so we do give you the voucher for him. And these are really good because they are done as a free one-on-one half-hour session, so it's you guys, the dog and the trainer. And she's got a whole bunch of great tips for any issues you're finding he's having. All right, so we're all good.
Tell me, why did you decide to get an adult dog over a young puppy?
Do you want to answer that, Geordie?
Well, I just thought some dogs like Jack, they don't have very much luck. I reckon we should adopt Jack because could be one of his only chances to
Yeah, that's
have a
right.
family.
A lot of older dogs sometimes struggle to find a home, and puppies, because sometimes they're perceived as being smaller and cuter, do find homes a lot quicker. But I think Jack's incredibly lucky that he's found you as his new family, and I think you guys are going to have a long, happy future together.